Hi, I'm Mr. Ganapati, orthopedic consultant, aesthetic unit. Today, we're going to have a video chat with our first day surgery hip replacement patient who had the surgery in February this year. She was quite apprehensive. We are also a bit cautious because this was the first day surgery hip or knee replacement we are doing. So I asked her to do a video blog so that we can understand how she was doing as well. So I'm going to have a chat with her and also go through the video blog with her to relive the first week post-surgery. Hi Yvonne, how are you?
Oh, I'm very well, thank you, Mr. Ganapati.
Okay, you had your hip replacement in February 2020, that's this year, yeah?
Yes.
And you were the first patient to have the day surgery hip replacement at aesthetic unit.
That's right, yes.
And
Okay,
yeah, as it was new to as well, ask you to do like a video blog after you go home. And thanks very much for doing that. So what I'm going to do is, I'm just going to jog your memory by sharing the videos, and then you can say what did you think and how did you cope, and then would you still have the same procedure like a day surgery? Okay,
sure.
so hope it works. Okay, I think this is the first video. That's the day one, yeah. And I think the occupational therapist and the physio came home, I believe.
That's right, yes, yeah. Gosh, I
And,
don't even remember this.
yeah.
Well,
So it's now 9 months, isn't it? 10 months.
It will be,
Yeah.
yes.
Okay.
Yeah. Now it feels like such a long time ago.
Yeah, and I think you made your cup of coffee.
Yeah. Gosh, it's amazing how far I've come.
Yeah, I think that was within about 24 hours after surgery, isn't it? Something like that. Yeah.
Yeah, I think that must be a couple of days.
First.
Yeah.
No, this is first day, I think, when they came.
Oh, okay, yes,
That's
yeah.
what you said. And then this is your actual blog saying.
Hi, my name's Yvonne, and I've recently had a total hip replacement on the 12th of February. It's the 14th today, and I went home on the same day as my surgery. I was a little bit nervous about that, as to how I will be feeling after the surgery. But it's all worked out really well. I felt great after the surgery. I felt well enough to be going back home. On the day of the surgery, I got in for about 7 o'clock in the morning, and as soon as I arrived on entry ward, the team was fantastic. I was just made to feel really welcome, really safe. Yeah, lovely team. I wasn't ever left by myself. There was no time to worry. It was quite a busy day, which was good. It was quite distracting from what was going on. And before I knew it, I was going down to meet the anaesthetic team, who were brilliant. And then they made me really comfortable. Went into the surgery, watched my iPad for a bit, so that was good. And before I knew it, I was back in the recovery room with a nice nurse, having a chat, and she was making sure I was okay, and before I knew it, I was back on the ward. I think I had an x-ray, sat in bed, had a sandwich, cup of tea, piece of cake, felt great, didn't feel groggy at all. And then, yeah, back into my own clothes, and I was sat up before I knew it. The physio and OT, who were great, came to see me. And before I knew it, I was up walking on crutches. Practiced the stairs. That all went really, really well. They were happy for me to be discharged, and I was happy to go home as well. My husband picked me up from hospital, came home feeling really confident, managed the steps to get into the house. Yeah, fantastic. I can't thank everybody enough.
that was quite a good sort of a summary of the, the day you were a few hours in the hospital. And now, next video, I think this is the second day post-op. You're describing what you are doing and how things are.
But I'm managing well on the 2 crutches. And actually, I just realised I'm just stood up here making this video just with the 1 crutch. But I feel really good on my feet. My legs feel really strong. The wound doesn't hurt at all. That's really comfortable. There is I've had a little bit of pain since I've come back, just sort of overnight. But the medication's good, and it's compared to the first night when I came home. Last night wasn't as uncomfortable. So that's working really well. I managed to have a shower this morning, managed to step over into the bath after the OT and physio came to see me yesterday at home. We actually practiced going up the Crogloft steps, which went really, really well. So and I think I made a cup of tea as well. So that's really positive. Just really excited about moving on and just progressing a little bit every day. Thank you.
Now you mentioned in that, so you were quite nervous before the surgery, which obviously it's very understandable. And I remember when we told you about that, you're quite emotional as well, isn't it? Can you describe what did you feel?
Oh God, nervous. That was an understatement. That's kind of you. I think I was so nervous when I came to see you and met the rest of the team. I think I'd call it more of an emotional meltdown. I just remember bursting into tears, just feeling so overwhelmed, and I think I ran out.
I know. I think everybody's.
I was.
Sorry.
It was I think it was a build-up of a lot of hope, just waiting for the surgery, and quite a few years of. I think I was shattered, fatigued. I was worn out, fed up. I was quite low.
That's true.
And then the cavalry arrived, where we're going to sort you out, and it all just got too much. But
I think that time, because this was the first time we got all the multidisciplinary team, isn't it? Like physio, anesthetist, pharmacist, everybody came and saw you, and obviously because this was the first one, and we just gave you a lot of information as well, I guess. Yeah.
Yes, yeah. Everybody was lovely, and I was just emotional. But,
yeah, that's true.
I think after that point, everything sort of came together again. I wasn't nervous at all after that.
On the day you were very good. Now you describe in this video that you hardly had any pain, but we do expect you are probably a lucky one that you didn't have much pain, but we do expect moderate amount of pain during these initial days, which should settle.
Yes.
And that's you climbing the stairs.
Okay, I remember that.
That's day 5.
It's day 5. Yeah. Couldn't bother to get out. Yeah, that was I'll give myself a good. Gosh, that was a little challenge. But I was really pleased that I'd done that, just to prove to myself that I could do it. I'm going to pop upstairs just to dry my hair. We've not got normal stairs. We've got a Crogloft. And the hip never hurt at all. I get aches and pains, muscular stuff as things are settled down, but no, really good. But the pain relief was really good as well, wasn't it? So we've put some non-slip grips on the steps. I think they're for yachting, for boats, I think. Just got a handrail at one side. There's nothing at the other side, but we've put a grab rail up that runs along. And my clever husband has attached, he's into climbing, and he's attached a clever rope for me to hold on to when I come back down. So I won't use it on the way up, just on the way down. But I'm going to head up and we'll film me again coming back down in a minute. Okay, bye. Good leg.
Steps are a bit steeper than usual, it looks like, isn't it?
Yes. Yeah, I'm still going up and down them, still using the same little rope, still taking my time and being very careful. Yeah.
It's well done. That is coming down because I need.
Yeah, I was really nervous about coming down.
I didn't realize about this, innovative way. Your husband has put the rope to help.
That's it, yeah.
I need to ask the physios whether this is something happens.
Yeah. No, it's it worked out really well. Like I say, I still use it now. So it gives a bit more confidence.
That's good. I think that's day 8.
Good morning, it's day 8. Had a good night's sleep last night. That's getting a bit better. On my feet I'm a lot better as well. The hip pain is which I keep forgetting about, is totally gone, which is absolutely fantastic. Just a bit still discomfort sitting down, so I'm finding that I'm sort of sitting and standing and pottering and just pacing myself throughout the day, which seems to be working quite well. The weather's horrendous today. I was going to go out for a walk, but that's not happening. Zach's gone back to work. He's working this afternoon. And the bad news is that we've run out of towels, but even worse is that I feel like tackling the washing machine. It's good morning, it's day 8.
I think this is where you wanted to tackle the washing machine.
Washing machine. I just wanted to try something normal and see what would happen.
Who was filming this?
A friend that had just popped round to the house to see me.
Okay. Excellent. Okay, now you've seen everything now. So the first question is, do you think if you had an option again, would you consider having the surgery again as a day surgery?
Oh, most definitely, 100%.
Right. And the other problem now with the coronavirus, we don't want patients to stay in the hospital if they don't need to. So that's what we are again restarted that. And you are relatively young than most of the other patients, usual patients, and you are an occupational therapist as well, so you know something about rehabilitation. So what do you think somebody who is around 70s should be able to manage these sort of things with adequate home support and with all the information provided by us?
I think if I was living by myself, because I was quite fortunate in that my husband was with me, but if I was living by myself, I think having a little bit of home care for the first couple of weeks, somebody just popping in just to help up a meal, see that you're okay, that would be a great support.
One of the things we are very strict about is that you should have adequate, home support for these type of surgery. Otherwise, it will be difficult. That's what we call it as champions, or the carers. That's what we are involving everybody. And the other thing is about the pain medication. All the information provided. How useful was that?
It was very good. I've been in touch with the pharmacist and
Mhm.
I to put some suggestions as to how to
Yes, she
change the
told.
paperwork.
Yeah.
There's so many tablets to be taking regularly. It was a little bit difficult to keep track of things because every day turns into Groundhog Day with the tablets, and it's so easy to forget if I'd taken them. So just having a good checklist just to tick off was
Yeah.
was great.
Now we are also, because for you the physio and the occupational therapist came home, isn't it? Now we are trying to do everything by Skype or Teams or something like a video consultation, and also we are getting the family involved in all the pain medication so that it helps as well.
Yeah.
So okay, thanks very much. How are you doing now? You're back to normal?
What is normal? I was thinking this earlier.
Right.
If you'd asked me before the surgery, normal was pain, giving up
Yeah.
all my hobbies, leisure, not walking, struggling in work, not coping very well, just getting by.
Yeah.
But normal now is back in work, doing everything that I need to, but not suffering for it. Back to hill walking, getting out and taking up photography, and just started a course. And getting back in the garden, still pacing myself, but that's I think, quite a healthy thing to do. But it's going really well. So it's 100 million times better than before. It's fantastic.
Excellent.